www.healthcmi.com. Acupuncture continuing education online today. Acupuncture diabetes treatment found effective. You can go to healthcmi.com, click on news, and take a look at this article published May 9th, 2022. Now, the research is showing that acupuncture benefits diabetics. There's two pieces. The first piece is a laboratory experiment, and there they find that acupuncture benefits the cells and helps basically the biochemical processes of the body and regulate glucose levels. The second one is a human clinical trial using electrostimulation on acupuncture points and also showing that acupuncture benefits patients with insulin resistance and helps regulate glucose levels. So this is very interesting because there's two aspects to traditional Chinese medicine that can benefit type 2 diabetics. One, herbal medicine, and that may be first and foremost. And there really are a variety of herbal medicines that have long been proven effective in modern research and traditionally throughout the years. Now, the modern research is definitely supporting the acupuncture, which is very, very interesting. Together, acupuncture plus herbal medicine is a lot more effective than either alone. Now, why? Because they both act on the same systems. And by combining acupuncture and herbal medicine acting on the same systems, they do have a multiplicative effect. In this study, they used acupuncture points, stomach 36 and spleen 6. They used electrostimulation of it without needles and still got the results. Now, what they found was several blood chemistry elements within the human body improved. Let's see, they said application of electrostimulation on stomach 36 and spleen 6 prevented high blood sugar and improved insulin resistance problems. So pretty good. And they give you the indices that they measured in the blood and everything in this article. So if you went to healthcmi.com and clicked on news, you could take a look at this article entitled Acupuncture Diabetes Treatment Found Effective. And it gets into the details of the research, so you can see, for example, a comparison of drug therapy compared to acupuncture therapy, where the benefits of the acupuncture are, things like that. And what you can expect. In my own clinical experience with diabetics, almost 30 years in the clinic, I will say that my personal experience confirms this as well. So the research is there, but on the ground, in the clinic, day after day, treating diabetics for decades, yeah, we definitely get the result. There's no doubt about it. Nothing is going to replace the need for dietary modifications, potentially increasing a lifestyle exercise, and reduction of stress, with diet being probably one of the top factors there. In other words, if someone goes out and eats a dozen donuts, well, that's not, maybe they're not the person for the acupuncture and herbs. But if they are starting to slowly modify their diet, get everything in line, and work on things, and they really want to get rid of the diabetes, then acupuncture and herbal medicine can really be an important component. Of course, dietetics plays a huge role here. And without that element in place, then the acupuncture and herbs are just chasing something that won't fix, because there's no way to eat poorly and use medicine to control diabetes. It just doesn't work that way. This is good research. I like it. I hope you have a chance to go and look at it, because diabetes is very destructive. I will say in my own career, and you can take a look at the HealthCMI newsroom about this, I've saved a lot of digits, fingers and toes for people. I've saved people's eyesight, because diabetes can endanger these things. And clearly the results were in. I knew the research. I knew the ancient history of it. I knew the modern research. I knew what points to do, and I did them. But more importantly, all that paperwork doesn't mean anything unless on the ground in the clinic you're getting result day after day routinely. And I did expect those results. In other words, when a patient came in and said, I'm having problems with my fingers, the doctor said, maybe I will need to amputate, et cetera, et cetera. I said, no way. If we buckle down, you eat a little better, we do the acupuncture and herbs, we can save it. And yes, that was my experience. We can save that. Now, there are some complications beyond this, and this is where I encourage diabetics to be very, very careful. And that is specifically surgery, because diabetics are at super high risk after surgery. And I do recommend diabetics to avoid cutting of the skin of any kind, particularly for surgery, if at all possible, until we can get things under control. So better to wait and not rush ahead and say, oh, well, they said, I have these problems in my feet because I'm diabetic and I had numbness in my feet, so I broke a lot of bones, and therefore they're going to correct it, and they'll just go in there and shave this bone and cut that and do this and that, and everything's going to be great. The problem is one has to recover and heal from the surgery, so better to wait for the acupuncture and herbs, diet modification to get the blood sugar in line. And then if some orthopedic corrections need to be made, long-standing chronic problems that have become very troublesome for the patient, then do it. Better to wait, do a little bit of work up front in getting that blood sugar under control prior to surgery. Then the outcome of the surgery is going to be much better, and the patient will not risk amputation, because the risk of infection and non-healing wounds with diabetes is very high. So again, this is my caveat. Medicine is good, but careful in the order in which you use it. I recommend, 1, getting everything under control, postpone as long as possible any major surgeries or even minor surgeries. And then once it's under control, then go for it. Then fix those problems that may have occurred. So in the case of a patient who really needs that surgery sooner rather than later, then be more aggressive with the acupuncture. Do 2-3 times a week for a while. Do the herbs and the acupuncture together. Find a licensed acupuncturist in the area who can do this, who is experienced with that, and do it. If you're not in a rush, you could do once a week for a while and go a slower pace and slowly bring the blood sugar into line. So it really depends on the patient's need and the time frame in which they need medical care. So again, if surgery is going to be coming up in the next few weeks or few months, then a much more concentrated regimen of care is needed with the acupuncture and herbal medicine to get things in line. So that would be my recommendation, just as a general rule. So patients can expect significant effects on reducing blood sugar levels and regulating blood sugar levels with the acupuncture and herbs, and again, combined with dietetics modifications. So go to healthcmi.com and take a look in the news department. You'll find several pieces of good research in there on diabetes, but of course the one May 9th, 2022 is entitled Acupuncture Diabetes Treatment Found Effective. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com. Until next time.